How to overcome nicotine addiction for stroke prevention. Nicotine addiction, especially from smoking tobacco, is a significant risk factor for stroke. Quitting smoking is essential for reducing this risk and improving heart health. The journey to overcome nicotine addiction involves behavioral strategies, medical treatments, and support tailored to each person. First, let's understand why quitting smoking is crucial for stroke prevention. Smoking contributes to atherosclerosis, which is the hardening and narrowing of arteries. It also increases blood clot formation and damages blood vessels. When you quit smoking, your stroke risk decreases significantly over time. Research shows that within 5 to 10 years after quitting, your risk of stroke can drop to levels similar to those of non-smokers. Additionally, quitting smoking lowers the chances of other heart-related issues, like heart attacks and peripheral artery disease. Now, let's explore some effective behavioral strategies to help you overcome nicotine addiction. One of the most beneficial approaches is counseling and support programs. These can be individual, group, or even phone-based. They help you build coping skills and stay motivated. Setting a specific quit date can also make a difference. Preparing for challenges and identifying triggers that make you want to smoke can help you manage cravings better. It's also important to avoid situations or emotions that trigger your urge to smoke. Engaging with family and friends or joining support groups can provide the encouragement you need. In addition to behavioral strategies, pharmacological aids can significantly increase your chances of quitting. Nicotine replacement therapy, such as patches, gum, or lozenges, provides controlled doses of nicotine to ease withdrawal symptoms without the harmful effects of smoke. There are also prescription medications like bupropion, which helps reduce cravings, and varenicline, which affects nicotine receptors to lessen the pleasure of smoking. Always use these medications under the guidance of a healthcare professional, especially if you have a history of stroke or heart disease. You might have heard about e-cigarettes as a way to quit smoking. While some people use them as a cessation aid, their safety and long-term effects on stroke risk are still unclear. Current evidence suggests that vaping can harm blood vessel function, and using e-cigarettes alongside traditional cigarettes may increase stroke risk. Therefore, it's wise to approach e-cigarettes cautiously and not relying on them as your main method for quitting. Professional medical support is vital in this process. Healthcare providers can assess your smoking history and readiness to quit. They can also refer you to evidence-based cessation programs and prescribe appropriate medications while monitoring for side effects. Ongoing encouragement and strategies to prevent relapse are also essential parts of the support you need. Lastly, overcoming nicotine addiction is a long-term commitment. Relapse can happen, and it's important to stay persistent. Continuing behavioral support, recognizing early signs of relapse, and using medications as prescribed can help. Making healthy lifestyle changes that support your goal of staying smoke-free is also beneficial. In summary, overcoming nicotine addiction for stroke prevention requires a comprehensive approach. This includes behavioral counseling, medications, professional support, and a commitment to staying smoke-free. Quitting smoking not only reduces your risk of stroke but also enhances your overall cardiovascular health, making it a key strategy in stroke prevention. Always remember to consult with healthcare professionals for personalized advice and support on your journey to quit smoking.